good. So, I was just going to ask you now. Today, you had to have a procedure done.
Yeah, sure did.
And tell me a little bit about that. Were you a little bit concerned about if you've never had a root canal before?
I think I have once before a long time ago. So
Okay.
and it wasn't a very positive experience. But
Right.
So I was a little nervous coming in today.
And how did it go for you today?
It went very smooth. Very
Okay.
smooth. Very pleased so far.
So maybe not as big a deal as you thought it would be.
Not near as big a deal. Probably made it a 10 in my mind. It was only about a 2.
Well, there you go. Now I was going to ask you another question because when we first saw you several weeks ago,
Yep.
I knew you were pretty apprehensive about having dental treatment done.
Told you I was a wimp.
You what?
I told you I was a wimp.
And so we sedated you.
Yep.
And tell me a little bit about your experience being sedated and what that was like.
That was really went smooth. Took the pill in the morning and came over here and pretty much remember getting in the chair. And after that, it was pretty much wake up and go home and very low pain level afterwards. And just got a good day of rest to a certain extent. It was much better than I anticipated. So definitely something that I would recommend.
Okay. So you think it makes going to the dentist easier for you? I mean,
Much easier, much easier. It would, knowing now if I would have known then what I know now,
right.
The apprehension level would have been almost nothing because it went very, very smooth.
Well, that's good. Now, on a scale of 1 to 10, as far as anxiety before, I think you told us that you were a 12.
Probably about a 12. Pretty much, yeah.
And it really just doing the sedation just completely took that
Completely
off.
took it away. I mean, very relaxed coming in. You come over and you're basically in a really relaxed state, even though you're functional. And then when I got into the chair, it pretty much a little bit later, I don't remember much of the entire procedure, and that's the way I wanted it. And the aftermath was very low pain level, if any at all, and the recovery time was very quick. So all of it was much better than I anticipated.
Great. All right. Good.
Thank you, sir.
Yes, sir.
Appreciate it.